wherever you are around the world. Welcome to Unheard Stories. I am Lubna Hassaniya, and I come to you from the Golden State, the state of California. Today, we will discuss the mental health crisis that is sweeping the globe, understand the symptoms of mental illness, and learn how to help loved ones reach a state of mental well-being. Our guest is clinical and neuropsychologist, Dr. Anthony Francisco. I would like to first welcome the dignitaries attending our discussion. We have His Excellency Ambassador John Macaron. We have Honorable Mirna Khawli, former Consul General to LA, Honorable Anthony Asher, our Honorary Consul for the Greater Cleveland area. We also have with us Honorable Judge James Cado, Honorable Judge Tony Raphael, and Princess Hayat Arslan. Thank you all for joining me. According to an article published just 2 days ago by the U.S. Preventative Services Task Force, the percentage of adults with recent symptoms of an anxiety or a depressive disorder living in the U.S. increased to more than 41% from August 2020 to February 2021. The Surgeon General reports that mental illness is so common that few U.S. families are untouched by it. But this dire situation is by no means limited to the US. Prior to the pandemic, 1 billion people from around the world were living with some form of mental illness. The outbreak of COVID-19 has taken this crisis to a whole new level, undermining the mental health of millions more. People with mental illness don't necessarily look sick, and their condition could range anywhere from mild depression to a severe debilitating psychiatric disorder. The complexity of the human brain, with all its 86 billion neurons and 100 trillion connections that control every function of our bodies, from our organs to our muscles, from our thought processes to our emotions, makes it a daunting task to try to understand how it works. With us today to share his decades of experience in neuroscience and cognitive behavior therapy, as well as his insights into mental illness, is Dr. Anthony Francisco. Dr. Francisco is a clinical and neuropsychologist. He has served as clinical director at the United Nations and as director and clinical psychologist at the National Pain Institute, among the many other positions he's held. He is the president and clinical director of Eagle Psychiatric Group, as well as Comprehensive Diagnostic Group, and is currently affiliated with the Los Angeles Medical Center. Dr. Francisco is a member of the American Psychological Association, an emeritus member of the National Academy of Neuropsychology. He was recently recognized by the city of Los Angeles for his dedicated service to the affairs of the community. Dr. Francisco, welcome to Unheard Stories.
Good morning, Lubna.
Good
How
morning.
nice to be here. Good, excellent.
Sunshiny day, we're lucky.
Of course.
Well, Dr. Francisco, the history of your last name is very unique. It is traceable to your great-grandfather. So it's basically 3 generations old. Can you share with us how the last name Francisco came to be?
The story goes that right around a couple of hundred years ago, about 1880, my great-grandfather traveled to the Caribbean.
Mm-hmm.
And landed in Santo Domingo.
Okay.
And soon after that, they had the jewelry. And then they went to Puerto Rico and had another jewelry. And his first name was Francis.
Okay.
Originally from Lebanon.
Mm-hmm.
From a little village that has grown to become a big village called Zgharta.
Okay.
And right around the 1900, when the U.S. first did their census,
Mm-hmm.
they came evidently at noon while he was taking his siesta.
A nap.
And his jewelry was called Francis and Company. And so he was not there. And the census gentlemen wanted to go to lunch and have their siesta. So they said, okay, well, Francisco,
Mm-hmm.
that. And it stuck. and it became, Francisco. And then my grandfather, whose name was Jamil, which is Emilio in the Caribbean and the Spanish, became Emilio Francisco. And then right around 30s, in the late 30s, they went on a vacation to Lebanon. They had 3 children, my uncle, my father, and another kid who passed away in Zgharta.
Okay.
Then they decided to remain in Zgharta, and I was born in Zgharta. I was raised in Beirut, and I went to school up to high school in Matalem, as we call it, in Beirut. And that's how it was. It continues to be Francisco, which is fine.
Yeah. Yes, excellent. And so you were born in Lebanon. Your father wasn't.
I was born in Lebanon. However, my mother was born in Africa.
Yes, yes. And they met in Lebanon, your mom and dad.
They met in Lebanon.
Yeah, that's great. The amazing truth about Lebanon is that the millions of Lebanese born and living abroad always feel nostalgic for that country and end up going back to either live, go to school, or simply to visit. It's an inherited love we have for Lebanon.
Yeah, paradise.
Yes.
Another slice of paradise.
Yes, it will always be for us.
Absolutely.
How did you end up in California then, Dr. Francisco, and why did you go through the field of psychology?
Well, from Lebanon, I went to Munich University in Germany. And I was fascinated by human behavior. I was fascinated by all the literatures coming from the Freuds, from the Viktor Frankl, from the Pavlovian, etc. And I started studying there. Then I came for a small visit here. And before I knew it, my transcript had gone to UCLA, and UCLA called me and said, "We'd like to have you as a student." I said, "Okay."
I'm coming.
I'm coming. And I never went back. In fact, my clothes are still there. I never went back. I bought a house. I never went back.
That's a good one. That's a good one. Well, you're lucky to have ended in California. Let me tell you that much.
Very.
And what's there better than to be equipped with the knowledge that allows you to get a deeper understanding of your own mind, of your own behavior, and the behavior of people around you, right?
Absolutely. Absolutely. It's in one word, being a clinical psychologist is a calling. And I had that calling, and I enjoyed it, and I continue to enjoy it.
That's something very
important. It's very rewarding when I see somebody say, "Oh, really? Oh, okay, I'm feeling good."
Yes, that's excellent. You have to have that calling to excel in life and anything.
Yeah.
What is the intrinsic value, Dr. Francisco, of good mental health? Why is it so important to be in a good mental state?
Well, we have to be able to maintain a sense of well-being, a sense of happiness, a sense of being able to pursue other interests, be able to have relationships, healthy relationships. That's very important. And to be able to live life as life offers it to us, rather than being miserably depressed or anxious or having that fight or flight reaction.
Is it something we learn to be? We learn to live that way?
I think we develop it. I think I think we are, especially in this day, we are bombarded with various factors that occupies us, occupies our mind, so much so that unless we are comfortable with ourselves, comfortable with our well-being, and knowing what to do with our well-being, we can succumb to the pressures and the stresses that bombard us today in this life, whether it's here or international.
So we have to really learn how to deal with the stresses and face those challenges.
And apply that learning material to ourselves. So that,
and so that also we can become active members of the community and we can develop emotionally.
That's very important as well.
Yes.
It distracts us from being introspective.
That's a good point. Now, you just talked about mental wellness. How do you define mental illness?
Mental illness is when you are not feeling happy. Again, it is on a spectrum. So I'm gonna keep it on the between 1 to 4 or 5 on a scale of 1 to 10. It's being happy. It's being able to be satisfied with what you are doing and gain the happiness that what you are doing is bringing happiness and satisfaction into your mind. Being well with your friends, being well with your family, which is very, very important. I hate to be repeating myself, but all these play on the spectrum of from good mental health to mental disease.
Yes, severely debilitating mental illness.
Yeah.
So it is basically what you're saying. It's a disturbance in our emotions, in our cognition, maybe in the way we think of ourselves and of others and how we deal with others, right? And like you said, you mentioned the word spectrum. So are you telling me that mental illness is not binary? It's not, we're not either mentally ill or mentally healthy?
Well, we have to subdivide it beyond on a scale of 1 to 10. Again, we talk scaling. On a scale beyond 5, from 5 to 10 is where we have the genetic, we have the physiological diseases, whereas beforehand, from the 1 to 5, we have the slight to moderate or severe depression, slight to moderate anxiety or severe anxiety, slight to moderate stress, post-traumatic stress disorder, etc., etc. So we keep those on a scale of 1 to 10, around 1 to 5. Beyond that, we have the bigger issues of mental health, which is the schizophrenia, the autism, the psychosis, the people who are really not here, and it goes down to about 9 where they really need to be hospitalized.
Okay, so the spectrum contains basically all the disorders. They are aligned between extremely mild, and you mentioned depression and anxiety can fit there, and go all the way to ones that are caused by the genetic mutations.
Absolutely.
And that's when we really need to look at them very seriously.
Yes.
Okay. Since we are on a spectrum, and since in the course of our lifetime, each one of us is prone to countless hardships, Dr. Francisco, that jeopardize our mental illness, mental well-being. Can we state that good mental health is defined by the absence of mental illness? In other words, are we healthy because we have no mental illness, or are we healthy because we're not showing any symptoms?
Well, that's very interesting. Let me answer it in a different way.
Mm.
When we talk about mental illness, it's a health problem that has a large effect on our thinking and actions. Emotions, mood. It often impacts our day-to-day life and day-to-day relationships. And it causes problems at work, at home, and social settings. It's nothing to be embarrassed about because it can be treated. But much like diabetes and heart disease, mental illness is a medical problem. And it's not for anyone to be blamed. It just, they succumb to the pressures, to the stresses, to the things that are directly in opposition of their thinking, and they don't know how to interpret that. They don't know how to internalize that and deal with it.
And society holds a stigma. And, you know, the reason why we are doing this today is to spread awareness. Like you said, it is a disease and we have to consider it as such and try to deal with it.
Absolutely.
Yes. So because, yeah, go ahead.
No, go ahead. You go ahead.
Yeah. And, you know, we talked about mental disorders. They are on a spectrum. So you really don't have a treatment, a one-size-fits-all treatment, do you?
No. And this is where it differs from the regular medical setting. Whereas if you have a cold, you can have a little antibiotics, a little Motrin, a little Advil, and sleep a couple, 3 days, and you'll be fine. Whereas in the mental illness, it is when you have it, you begin to know that you have it because you have that fight or flight syndrome. You're on edge. You don't know why you're on edge, but nonetheless you are on edge.
Okay.
And that that's called stress. But if it continues, then it becomes anxiety. If it continues, it becomes depression. And it hits physiologically, it hits the brain, where you begin to have a rush of adrenaline and cortisol. I don't want to bore anybody with chemicals, and it also, which I really want to emphasize, increases the heart rate and spike blood sugar, which is diabetes, which is 80% of 75% of the people are plagued with that. So it all starts with you know, the big words, stress and anxiety and depression.
So basically you're attaching to the whole process a time factor. If we are in stress for long enough, we might turn into anxiety. And if we are in anxiety long enough, then it's a serious depression. Is that what you're telling me?
Yes. Yes.
And does it mean that for us to address the issue, we need to do it early on when we first realize there's something wrong?
Absolutely. Absolutely.
Okay. Yeah. Okay. So, you know, you're talking about each mental illness has its own specific symptoms, right? But are there some general warning signs, Dr. Francisco, some abnormal behavior? You called it abnormal the other day. That we can, you know, as siblings, as parents, as good neighbors, we can be on the lookout for to help others. What are the signs?
The signs are for us as parents, for us as friends, for us as members of society when we see mood swings in somebody that did not have mood swings.
Okay.
You know, and maybe some crying, maybe some difficulty in bonding, maybe loss of appetite, some irritability, some sense of hopelessness, staying in the room,
too long,
avoid socialization. All these symptoms are signs that something is ongoing.
mm-hmm.
and the best way of dealing with it really is, number one, communication. If
Mm-hmm.
you have good communication,
Mm-hmm.
and if you don't, which is probably most of the parents and friends
Mm-hmm.
in today's age,
Mm-hmm.
then a visit to the general practitioner as a first line of defense is a very important, because they begin to ask about that as well. They're trained to perceive something is going on, something is wrong, and as they can't deal with it, then they refer it to a behavioral field
Mm-hmm.
to make sense of it and begin to disperse it.
Yes. So basically look for signs of change in the behavior. And if it persists long enough, then maybe go to the general practitioner first. And then from there, you go to a psychologist.
Right. Absolutely.
Yes. And you
Unless,
know, yes.
excuse me, unless the parent or the friend has enough, and that's very important, enough communication, intimacy, and skills to talk to the person who is going through all these changes, to try to reassure them that, hey, it's gonna be okay, let's go and do something about it.
Mm-hmm.
Or
So,
tell me
yeah.
what's going on.
Yes, open the dialogue. And so you're telling me in the beginning, we can actually reverse it? We can have the patient snap out of it?
Again, we go back to the spectrum.
Yeah. Okay.
How bad is this person feeling? How bad is the
Trauma.
spectrum from 1 to 10?
Yes.
And if it is beyond 5 or 6, hypothetically, then they need professional help. Before that, the communication can solve a lot of problems.
Yes.
A meeting with the family, a conference with the family meeting, you know.
Yes.
It's very, very important.
Yes, definitely. It is important. Now, we so often hear people say, you know, from our kids to our friends to our siblings, I'm depressed. I'm depressed. When do you take them seriously? Because this is undermining really the seriousness of depression. If I'm depressed is taken so lightly, you know, and brushed off as something that they will snap out of, maybe it's not allowing us to pay enough attention. When do we say this is serious? You know, is it also, you know, what we have to watch them, not just rely on their words?
Well, you know, that's also very interesting and very important, because kids or people use one word that has many tentacles. You know, if you can visualize something that has so many tentacles, like an octopus. I'm depressed. That's because they either don't have the faculties in that field to say, well, I was anxious, I couldn't sleep at night, and I'm overeating or I'm under eating. They all lump it into one word, that's I'm depressed. At which point you either begin to unravel that to all the tentacles to help whoever is saying that, or take them to the GP, to the family doctor, where they have professional courtesy and they have all the confidentiality, and that reassures the person who's saying, I'm depressed. What does that mean?
Yes.
What does that mean?
Yeah. How is it affecting your daily life?
Is it depression? Is it anxious? Is it you're afraid? Is it, et cetera, et cetera. And then we go down the list.
Yeah.
Whereas,
well, it becomes very important to open that dialogue, to give the person a chance to express themselves and to show them that you care and that you're willing to help them, right?
And how do you help them? You provide them with some tools to understand where that depression is coming from, what has caused that depression, and what else can they do to help their own selves to ward off that depression, to deal with that depression, to lessen the effect of it.
Yes. I mean, I hated to have it sound so cliche, but we have to be involved in the lives of the loved ones. We have to be in tune. We have to talk to them on a daily basis and be involved with what they're doing and their friends they're seeing and their homework a little bit and what they're doing in college and at the university and how life is going for them. We need to be part of their lives. If we are prepared, this is what we need to do.
Absolutely. And one of the most important thing is to have a family meeting once in a while, maybe a couple times a month, so that set the rules that when we talk in this family meeting, nothing goes out of it. Nothing is talked about outside of that. You set the rules so that if you do it often enough, the children can begin to feel more secure in opening up in that meeting.
Yes.
Rather than keep it inside, that can fester into more grave things.
Yes. And you suggest once a week, you said, or once a month?
Once a month, twice a month, depending on the time. I mean, look, today's age are very demanding.
Yes.
The parents go and have one set of rules at work that I call this being an adult. The fight in the work arena.
Yes.
And then half an hour later, they're at home. The kids are at home, but they're still with that work. They're still in that mentality.
Yeah, in that mindset.
They're either ordering, being ordered, et cetera, et cetera. They cannot deal on that level with the kids, no matter how old the kids are. They have to change that attitude, become the parent, so that the parent can talk to the child. We call that a cross communication insofar as analyzing the communication so that parents and children can get better together.
Are there trigger words that you recommend the parent uses in that discussion? Are there like words that could get the attention of the child or go straight to the heart?
Not really. Whatever. See, the kids must feel the humanness.
Okay.
Parenting of the parent, not the parent who is at work in battle, fighting the sharks, fighting the waves, making decision on an adult level.
Yes.
Then they come home and they expect to communicate with a child who's going through their own process.
World. They have their own world.
So in my life, what I like to do is come down from my daily life to my family life, to my home life, insofar as telling the kids, how am I doing? Ask the kids, how am I doing?
Yes.
That brings them down to their level, and the kids can feel empowered.
Yes.
To say, Dad, you know, you
Yeah.
seem very anxious. You seem very on guard. You seem, you know, you want to fight. I don't want to fight.
Yes.
I'm using colloquial words, but
Yes.
the meaning is there.
Yes. So turn the table and come down to their level and communicate with them and ask them questions about yourself, their own opinion in you, what they think of you. That's
Help,
very interesting.
have them help you to come down to their level.
Yes. Yes.
Otherwise, you can't. I mean, life today outside is really a, yes, we enjoy it, you know, but we behave in what I call adult level, not a parent level. In our lives, we have three levels. We have the parent, we have the child, and we have the id, the ego, and so, and I don't want to go into that, but, you know, the adult is in the work, the parent is at home, and the child is always a child.
Yeah. When will the child not be a child anymore?
Never.
Okay. Okay. That's a good one.
The communication with them may differ, becomes more intelligent, more on an intelligent level, more on a cognitive level, instead of telling them, hand me the fork, or hand me the or what you do today in your homework, etc. There's no reason for to do that as they grow up.
Yes. Yes. It's
Become a friend.
Yes. Yes, exactly.
And be forgiving. Always.
Yes, definitely. If we don't forgive our children, who are we going to forgive, you know?
Correct. No matter what they do, because what they do is always for a reason that they do it.
Like anything else, whenever we do something, we did it for a reason.
For a reason. So
yes.
Unravel that reason.
And it could be unconscious, but it's there.
It's there.
Yeah.
And that is part of what happens in the meetings when you unravel all of that.
Yes. And this is what you do. You sit with them, you take your time, and you try. You usually sit with both parent and child together.
Yes.
You do? Yes.
I do at times, or my assistants do at times, but I do it with my own family as well.
Yes.
You know, we have twice two meetings a month.
Twice a month.
Yeah.
Okay, I'll start doing that. Dr. Francisco, when a patient comes to you, you have to base your diagnosis on the symptoms they're experiencing, right? And their gravity. There are no quantitative tests you can base your diagnosis on. No x-rays, you cannot base it on blood work, you cannot base it on urinalysis. You just have to base it on the behavior.
Yes, but now we are beginning to measure various frequencies in the brain. It is in the embryonic stages, but we're doing it in conjunction with USC, with Columbia Law, and Harvard and UCI.
Okay.
We are creating a cap with various sensors, which tell us which part of the brain is doing what at what time. But that's still in the embryonic stages. Hopefully in a couple years, 2-3 years, we'll be able to use it.
Yes.
For various diseases, such as severe depression, such as maybe schizophrenia, such as autism, maybe. We don't know yet.
Yes, yes, yes. But for the most part, you have to rely on the symptoms as of now, right?
Yes.
How objective does that make the screening process? How objective is it? If we are to talk across all the clinics, let's say just in LA, does the diagnosis differ from one place to another?
Well, yeah, when we go to Martha's Vineyard, the problems are much different than Los Angeles. And I do have an office there and different than where I live in Newport Beach.
Okay.
Or in the with the diplomats. It's there's slight differences in what it is that they come in for.
Okay. Okay. And you talked about communication, and this is where you boil it down to, that we have to have good communication tools to open up to the person in need and listen to them and have them listen to us. Dr. Francisco, there is an astonishing increase, and we talked about that, in stress and depression, and this is where you focus your work. This past Tuesday, a panel of medical experts recommended for the first time that doctors screen all adult patients under 65 for anxiety in the US. What do you make of that? And are you at all concerned that these new demands would add to the strain on health systems that are already overstretched?
No. On the long run, it is much more, it will cost much less.
Okay.
Because if you nip it in the beginning, it doesn't take very much to take care of it from the expense perspective.
Okay.
And if it continues, however, without being nipped, then it is very, very, very expensive. Mental health treatment is very expensive. We're talking about very expensive. I think it's the most expensive medical procedure.
Yeah.
Because it just costs a lot of money. So that was promulgated by the insurance companies, actually.
Okay.
Yeah, because they wanted to try to abate a little bit the cost of mental health treatment. Look what's happening in Los Angeles. I had to move my office. My office was on Wilshire, and within 2 years, the whole sidewalks began filled with the unfortunate ones who are in tents, who are homeless. I just could not continue to remain in that building, which I was going to buy. I had to go, and I went to Koreatown, where the Koreans don't let any homeless there, and there isn't a single homeless there.
Homelessness is directly linked to mental illness, isn't it?
Absolutely.
Thank you.
Absolutely. You don't make a decision to go homeless unless there is something wrong. Whether it's drug or alcohol or whatever, there is a reason.
Yes. And we need to address the cause.
Absolutely.
Not the symptom. We need to address the cause. These
Absolutely.
are human beings we need to take care of. It's our responsibility, Dr. Francisco. Are we short on mental health resources?
Yes.
In what way? Are we short on clinical psychologists, psychiatrists, clinics?
Yes.
What's missing?
Well, in the past, the insurance companies were always trying to avoid paying, reimbursing. That has now changed.
Okay.
Which is very, very good.
Yeah.
So now it's beginning to come more to the forefront.
Yeah.
And we're being able to extend more treatment to more people to really get them out of that bubble that they get themselves into.
Yes, yes. This is a very direct question, and maybe I'm asking for a direct answer. Is mental illness preventable?
No.
No, we cannot prevent it.
No.
Is it because of the risk factors are so rampant and so multifaceted? Or are we just prone to imbalance?
It depends on how we deal with all these imbalances.
Okay.
I factors of life always affect us, and it depends on how we deal with all these effects, how we process and not be affected by it. If we get affected by it and get angry with it, and get frustrated with it, get stressed with it, get anxious with it, then and continue to have that, then we become mentally unhealthy.
Mm-hmm.
And remember, mental health is health on the physiological and mental health.
Yes. Yes.
And I want to re-emphasize that diabetes, high blood pressure, all these are exacerbated by high anxiety and high stress, and not be able to deal with them correctly.
Yes.
Healthily.
Yes. So mind and body work hand in hand, don't they?
Yep.
And cures, you wouldn't call the treatments cures. We're not curing them. We're just helping minimize the symptoms, aren't we?
We're helping them process the stresses in a much healthier fashion.
Mm-hmm. When do you tell yourself, I need to resort to prescribing meds? When do you make that decision? Do you give them time? Is it just sometimes immediately you just go straight to meds? How does it work?
No. If a patient continues to have the symptoms to a gravity scale, then we can try some psychotropic medication. But psychotropic medication is a very complicated, if done right, it's very complicated because it goes with dosages. It goes with what part of the brain should we take care of, the serotonin, the dopamine, the neuroepinephrine.
Yes.
And then it is like a band-aid. They wake up groggy and they can't go to work because they're groggy. They can't drive because they're groggy. It's a very, we try to avoid it as much as possible.
Yeah. Good one. Dr. Francisco Aristotle once said, there is no great genius without some touch of madness, unquote. What can you tell us about the association between creativity and major mental disorders?
Creativity, which is very necessary actually for mental health. I like to recommend people to do something outside of the realm of work, outside of the realm of family, something for themselves. You can go painting, you can go golfing, you can go yoga, you can go exercising. However, the more involved in the studies of something, the more you become on the other spectrum of the standard deviation of the people. And in the curve, there is this 1% who are studying and creating and indulging in this and in a subject or another. These become on the other spectrum of the curve, on the standard deviation.
Yeah. Well, the silver lining is the silver lining, right? That Charles Darwin had OCD, Nikola Tesla was schizophrenic, Beethoven was depressed, Isaac Newton had periodic psychotic episodes.
You know, I worked with Linus Pauling. Linus Pauling.
Yes.
He created vitamin C. Yeah, and he was the only person who had twice the Nobel Prize.
Yes.
And he wasn't mad, but he had Asperger as well.
Yes. Yes.
God rest his soul. It great
takes
guy.
a different level of frequency, I think, to take them above everybody else.
Yes.
Nikola Tesla used to go into his room and just come out with genius equations that no one could put together simply by sitting in his room and envisioning things. This was his mind, the power of his mind.
He has Asperger, by the way.
Yeah, yeah. Dr. Francisco, thank you so much for answering the questions and for helping us spread awareness of mental health. Let's take some questions from the audience.
Okay.
To everyone in the audience, please leave your questions or comments in the chat box or raise your hand using the reactions button on the bottom of the screen. Do we have any questions here? I have one here. Dr. Francisco, we talked at length about, how to look for danger in someone going through some mental disorder. What are the critical periods when the onset of a medical disorder become more likely? Critical periods in life. Are there like critical time in the development in our lifetime when we need to be really on the lookout?
Well, whenever we are going through a stressful situation, for students, for instance, testing, conferences, etc. For kids, when they have colics, what do? They cry. This is the physiological stress, but nonetheless, this is the stress on the body. Adults, we always have emotions, we have stresses at work, we have whatever something doesn't work the way that we think it should work. Take Elon Musk when he gets into a Tesla and it doesn't turn on. He's got a lot of stress.
Yes, of course. Of course.
And again, it goes back to communication.
Yes.
You talk to the child and you say, I'm not seeing you as I'm normally seeing what's going on.
Yeah, thank you for answering that question. We're gonna go to Aida Mansour. I'm gonna ask her to unmute herself. Go ahead, Aida, press unmute, please. Yes, go ahead.
Hello.
Hi, we can hear you, Aida. How are you?
Hi, I'm fine, thank you. So my concern and my question is about the stress that is, triggered by attention deficit disorder and ADHD in adults, which actually lead to, a burnt out situation. You just can't stop, your mind is always restless, etc. So this also, I feel, leads to, excessive anxiety and like a feeling of a burnt out and depression. I don't know if the doctor has anything to say about this and how we can deal with it.
You're absolutely right, Aida. It does create a lot of anxiety. It does create a lot of stress, not only on the child, but on the family. And again,
I'm talking about adults actually, and it's me and my son as well. Yeah.
Most of the time we find that this is genetically transmitted to the children, but You need to go to your physician. We have 2 or 3 different medication. We have Adderall, we have Vyvanse. Depending on your personal situation and the gravity of your ADD or ADHD, or maybe Asperger, but your physician would be able to put his finger on it and help you out with both you and your son.
I have a fear of these medications because I always hear that they kind of, make you lethargic and, kind of.
Ida, let me tell you something. We hear all sorts of things from all other people. It is, like I said before, with psychotropic medication, we need to do a trial and error. For you, for instance, a 5 milligrams could be good, 10 milligrams could be very bad. You have to have good communication with your physician to try to moderate the medication grams to your personal condition and to your son's personal conditions, and the 2 may not be the same either.
Yeah,
but you have to try it. There's no way, otherwise you're not going to continue to sleep, and I'm sure you're not sleeping at night.
No, it's terrible, actually. Yeah, I wake up like 10 times during one sleep, and I wake up feeling tired and unable to focus, foggy mind all the time.
Yeah.
Yeah.
No, you have to go to your doctor and try medication. It will make your life much easier. And try to also always take the medication in the morning, because it may also interfere with your sleep, but it will help you sleep. It will give you a much better existence.
So which medication you suggested, doctor?
Either Vyvanse or Adderall is very good. It's not as expensive, and it just does the trick just as the other one.
Okay, thank you.
Of course.
Thank you, Aida. Thank you.
Sure.
Thank you.
We're gonna go to His Excellency Jean Macaron. Ambassador, you can unmute yourself.
Yes, okay. Hi, Dr. Lubna.
Hello,
Hi,
hello.
Habibi. How are you?
Fine, thank you. First of all, thank you for inviting Dr. Anthony. And many thanks to you for your important inputs, Dr. Francisco.
Thank you.
You said you explained mental illness in a perfect way. And I can now understand our leaders, because as we all know, most of our leaders in Lebanon are mentally ill. You said you said something. You spoke about healthy relationship and happiness. I always ask this question with all my friends: what is the secret of happiness? Right now, I didn't find the right answer. You said that being to be satisfied. I can assure you that many people are satisfied and they are not happy, while many people are not satisfied and they are happy. And you said, you mentioned Freud. I love Freud. Do you agree with me that he says something very important, Freud? He says that sexuality is the basis of everything. And do you think that love or sexual life is a good factor to treat mental illness? And finally, do you agree with me that everybody is mentally ill, but on different levels and stages? Thank you very much.
Where do you want me to start? Uh, uh, Going back to Freud, you are right. This sexuality and the gratification of sexuality is very important for men and for women, but it is just a one factor of the continuum. To be happy is not just a word. It is something that you experience. I am sure you have been into a place where you were happier than another place. Maybe traveling, maybe walking, maybe golfing, maybe doing some kind of sports, maybe yachting, maybe swimming. What I like to do is I like to take the experiences from a location or a space that I was very happy. And when I am under a lot of stress, and like the rest of us and the rest of our politicians, is I bring in the happiness that I experienced in that location into my field of existence. And that helps me a little bit to de-stress. The de-stressing is a very, very important. And the way you do it is by getting your mind busy on something else. Did I answer you?
I think so, yes. Thank you very much. And you say, we can say that everybody is mentally ill on different levels and stage.
Like I said, we have to look at it in a continuum, on a scale of 1 to 10 or scale of 1 to infinity. And we each have a touch that is with which we are more sensitive than others. And that creates a touch of stress, touch of anxiety. But if we have more of it, then we need to do something about it. But by the way, without that feeling of fight or flight and have a little anxiety, we can't really perform very well. You're a high performer. We're high performers. I take it that all the audiences here are high performers. That's because we've had enough anxiety to drive us to be high performers and high achievers. But beyond that level of anxiety, then we become on the scale. We get on the scale.
It's a delicate
balance. Thank you very much,
Doctor. Thank you, Ambassador. I will go to a note left by Sadhna Sharma. She's saying, thank you so much for highlighting the key factors in this realm of mental health. I have a question for you from Dima Saliba. She's saying, how can we convince someone, especially if he or she is a parent, to seek help?
By very carefully and lovingly help them to go to their primary physician. Period.
And if they are in Lebanon?
Same.
Okay.
Same.
Do they run the screening there on a regular basis?
No. But
maybe she has to have a word with the GP, general practitioner.
No. I'm not familiar with how they practice in Lebanon. But if it is a matter of necessity, then a doctor should normally
pick on it
and do something about it. And with the doctor has their ways in a confidential manner to present it to the individual that can be more acceptable than a friend or a parent.
Yeah, thank you. Thank you for answering that question. I hope it helps, Dima. Thank you for being with us. Well, Dr. Francisco, unfortunately, our conversation came to an end. Is there anything else you'd like to add before we wrap it up?
I personally enjoyed that. I hope that many of your audiences can take what I presented and apply it to whoever they need to apply it to, be it a friend, parent, or children.
Yes.
And I appreciate you giving me that opportunity to do so.
Definitely, definitely. It's a critical topic that we need to shed light on. And the ultimate goal remains to ensure our community is happy, healthy, and thriving, and to do all we can to create a transformation in the way we understand our mental health, the way we value it and protect it, so we can eradicate stigma, right? And discrimination from society.
Yes. It's happening slowly.
Yes, yes. Yes, that's very nice. Dr. Francisco, thank you again. And thanks to all of you for joining me today.
Thank you, Lubna.
Yeah, this event will be uploaded to my YouTube channel and shared on social media. Unheard Stories is a monthly event. It falls on the last Saturday of every month. Now, next month's guest is a young entrepreneur who pushed every boundary and dared to cross disciplines. He's a scientist and a visionary who's recreating the food industry and envisioning a food system that is efficient, circular, and waste-free. Dr. Mazen is the founder and CEO of Mush Labs, a food and technology company that uses fermentation to create sustainable foods from the roots of mushrooms. The company is headquartered in Hamburg, Germany. So please don't forget to register. You don't want to miss it. And that's it for today. Thank you again, everyone, for bringing us into your home and making us part of your Saturday. Goodbye, everyone. Thank you, Dr. Francisco.